This video is on Leishmaniasis and is based on an old copy of the Oxford Handbook of Clinical Medicine. So what is Leishmaniasis? It is a disease caused by a protozoan of the genus Leishmania. So it's a protozoal disease. It's spread by phlebotomine sandflies. And in developed countries, it usually presents as cutaneous leishmaniasis. This is caused by inoculation through a bite of a Leishmania tropica major or minor. So how does it present? Cutaneous leishmaniasis presents with an itchy papule from which crusts fall off, leaving an ulcer with sharp perpendicular edges. So you've got a papule, crusts fall off, and it leaves an ulcer with sharp perpendicular edges. Most of the time this heals spontaneously. There are other forms of leishmaniasis as well. There's cala-aza, there's mucocutaneous leishmaniasis, and Leishmaniasis mexicana. Let's do a quick bit on those. So cala-aza is called visceral leishmaniasis, presumably because it affects your organs. In this case, the protozoa are carried in the bloodstream to the reticular endothelial system of all the organs. And the pre-patent period may be greater than 6 months, so there's a long period between the inoculation or the bite from your phlebotomine sandfly and the disease. There may be a sudden increase in temperature with 3 spikes a day. There may be a rapidly enlarging spleen which can reach the umbilicus in a few weeks. And here we see on the picture a large spleen, and that little dot in the middle is the umbilicus. You also get hepatomegaly and lymphadenopathy. That's because it's reaching the reticuloendothelial system. What about mucocutaneous leishmaniasis? As the name tells you, it affects the mucocutaneous junctions. This is common in Brazil, Paraguay, and Argentina. So it's South American. Think of BAP, B-A-P, Brazil, Argentina, Paraguay. Often the primary bite heals without trouble, but in some cases, after a period of about 2 years, the protozoan metastasizes to the mucocutaneous junction of the nose and the mouth. This causes destruction, so you get nasopharyngeal destruction, and you may get death from pneumonia. So that's mucocutaneous leishmaniasis, which after 2 years metastasizes, causing destruction. Next is Leishmaniasis mexicana, which you can imagine affects Mexicans. It is more common in Mexican foresters, and if it affects the ear, it will cause local destruction, as you can see here. So let's go through that again. Leishmaniasis, it's a protozoal disease carried by the phlebotomine sandfly. The usual or major presentation is with cutaneous leishmaniasis, where you get a papule, scales fall off, it leaves an ulcer with perpendicular edges. The other forms are visceral or cala-aza, which has a long pre-patent period and then presents with a rapid increase in temperature with spikes and a large spleen, maybe hepatomegaly, maybe lymphadenopathy, and this is because the protozoan is carried to the reticular endothelial cells throughout the body. The other type is mucocutaneous, which after 2 years metastasizes to the mucocutaneous junction of the nose and the mouth. can cause death due to pneumonia. And the last type is Mexican Leishmaniasis, which can cause destruction of the ear. Happens in Mexican foresters. Thank you.